Has knee pain been slowing down your runs or actually making you stop running altogether? In this video, I'm going to discuss tips that I give to my runners as a physical therapist to help with knee pain. I will also share 3 exercises that I use for runners to help build stronger legs and to help prevent future knee pain. Tip number 1, never ignore your body. So whenever you're feeling pain, especially in the knee when you're running, that's your body's signal to the brain, letting you know that there's inflammation, that there may be some kind of tissue damage in that area. So a lot of times what I'll see with runners is they'll have a set time that they plan to run. So usually they'll say, I'm going to go for a 30-minute run. However, once they get to the 20-minute mark, they'll start experiencing some knee pain. And because they're set in their mind that they want to hit a 30-minute run, they'll just do that last 10 minutes continuously running through that pain. And even though you're hitting that mark, that's nice, but the result is you're causing increased inflammation at the knee versus if you were to stop at that 20-minute mark, you're going to prevent any accumulation of whether that be swelling, pain, or inflammation at the knee. You're going to stop that sooner. So tip number 1, for now, you can always build up the tolerance, the strength, and the times where you're running, and you can get to 30 minutes without knee pain. But right now, there's a reason why you're experiencing that knee pain, and that's why we'll typically evaluation, testing to see what may be causing the pain once you're hitting that 20-minute mark. Sometimes it's a imbalance or a deficit in terms of muscle strength. So your quads may be getting fatigued at the 20-minute mark, and then once they get fatigued, now there's more stress on the knee joint. So that's why it's like, okay, after we assess and we kind of determine, maybe we need to work a little bit more on that quad endurance, quad strength to reduce some of that knee pain and to improve your actual endurance to hit that 30-minute mark. But tip number 1, listen to your body. Don't run through knee pain. Second tip, icing after your runs. So whenever we're going for a run, essentially it's a bunch of single leg hops from one leg to the next over and over and over. That's a lot of impact. That can cause over time wear and tear on the knee. So naturally, you're going to have some inflammation in the knee joint, which is a normal response to that type of exercise, to the single leg jumping over and over from running. So icing after your run is going to help keep that swelling, keep any inflammation to low, especially if you've been dealing with chronic knee pain. You want to keep that inflammation down. So icing after runs for about 15-20 minutes will help with that pain. The third tip, and you'd be surprised how often I see this with more casual runners or people who haven't been running for years. It's been a while since they had their last run, and then they just want to get back into it, and they'll wear the worst type of shoes you can think of, shoes that aren't designed for impact for running. So for example, sometimes I'll see individuals who will run in Vans or some Converses or shoes that have poor cushioning. The design of it is meant for another purpose, whether that be for skateboarding or just not meant for that shock absorption with running. So that's a easy tip, but some people, they'll kind of underestimate the impact of wearing proper shoes. So make sure you're wearing shoes that are designed for running, so they're better for shock absorption to take some of that pressure, some of that impact off the knee joint. So whenever you're receiving advice about exercises for a medical injury, so for example, we're talking about knee pain in runners, you do want to consult with a physical therapist, with a medical professional, so they can evaluate and actually assess your movements, your limitations in terms of strength deficits or range of motion, your balance, so they can determine specifically what your body needs to improve on to help you reduce knee pain and to get you back to running more appropriately and back to where you want to be. Now, with that being said, I'm going to share 3 exercises that I often use with my runners when appropriate. And these exercises, they're targeting major, I would say more so the more common muscle groups that are often neglected and weak with runners. So, for example, the quads, the glutes, and the core. Those are often muscles that aren't overly trained or trained appropriately, where once they hit a certain fatigue level or if they're lacking some of that strength, it'll reduce the the muscle's ability to absorb shock, which puts a lot more stress on the knee joint, which can cause pain. So we're going to be targeting a few of the major muscle groups with these exercises. So let's get started. The first exercise is a single leg bridge. So here we want to focus on targeting one glute at a time to make sure we kind of balance out any deficits from left to right side in terms of the glutes. So doing a single leg bridge, doing a unilateral movement like this is a good way to specifically isolate left versus right side. And here, this is a nice movement because you're kind of taking out a little bit of the quad and hamstring and focusing a little bit more on the glute. You are going to get co-contraction of your quad and hamstring, but here, that's why I want you to focus on squeezing one glute to help you come up. Now, if you're having trouble performing the movement in terms of going a greater range of motion, what you can do is you can perform this while you're lying on your back, flat on the floor or flat on the bed. You don't have to be elevated on a bench like I am. This makes it a little bit more challenging. Or if that's still too difficult, you can always start with a double leg bridge and work your way to a single leg bridge. The second exercise is a Bulgarian split squat. So this is similar to a lunge, but here we're really taking out the back leg and focusing more on the front leg in terms of the strength and the stability. So while you're performing this, you want to have as minimal weight on that back foot as possible. So we're going to really target the quads and the glutes on that front leg. Now, you can also perform this with your foot on a Bosu ball. It doesn't have to be a bench, but something stable is usually a little bit better for stability. For this exercise, I do like to start off with around 8 to 12 reps and doing 3 sets to focus a little bit more on strength. Now, as that gets easier, if you can do more, moving up to 15 to 20 repetitions, that changes the goal a little bit more towards endurance. So if you want to focus on strength, you can always add a weight in your hand. The third exercise is a variation of a side plank, but with movement. So typically in physical therapy, we'll call this a DNS star. So this is really going to challenge the bottom hip. So that bottom leg, it's going to be working those hip muscles more so while working on that bottom side of your core while you perform the movement. So doing this isometric contraction with your hip while adding that rotational and reach component at the trunk engages a lot more your core. So this is really good for the stability and the endurance of your core and your hip muscles. So ignore my leg for this first rep, but the movement is going to be you're going to reach with that top arm, and as you reach, you're going to kick your top leg back. So they're doing opposite movement. So you're almost stretching at the arm and at the leg on that top side. For this exercise, I find doing 2 rounds of 10 repetitions on each side is pretty good to build a good amount of endurance and stability. If you made it this far, thank you for watching, and please subscribe to the channel to see more videos.